No matter if in a plane, train, or automobile, sitting motionless for long periods of time can put travelers at risk for deep vein thrombosis. It's a blood clot deep in the muscle, usually the calf or the thigh. The American Heart Association estimates that 1 out of every 1,000 Americans develop DVT each year. As Mark explained from our story in February, cardiovascular disease is a leading risk factor for DVT.
Dr. Charlie Hahn of Veins, Florida explains how cardiovascular disease and chronic vein disease like deep vein thrombosis and varicose veins often go hand in hand.
For the vein patients, they tend to have multiple symptoms and multiple problems, and we have a variety of ways to treat them. And I think nowadays the treatment is evolving and more than some other traditional medical problems. Varicose veins can cause blood clots in them, and then they cause a tremendous amount of pain, and we call the thrombophlebitis. Also, the larger it gets, they tend to pull more blood, which cause skin changes, color changes around these large varicose veins. It can cause skin ulcers, which will take a very long time to heal. And also they can cause a large amount of bleeding if they got injured. For thrombosis, the varicose veins, they carry a large amount of blood. That's why those veins are huge. And a lot of times they stay there for a long time. And for some patients, they can develop a large blood clots, which is not as dangerous as deep vein thrombosis. They tend not to travel, but what they can do is they can continue to grow and involve a large portion of the varicose vein and cause local inflammation, which is swelling and redness, edema, and these are very painful. Deep vein thrombosis, the clots that are located within the deeper vein, usually they're in the pelvis, and those clots can travel to the lungs, which can cause pulmonary embolism. But for varicose veins, they tend to be superficial. Those blood clots tend not to travel. For those large varicose veins, not the saphenous vein, we make a tiny little incision and they use a special instrument to pull them out. And that can achieve a great success by removing the vein immediately. And we can clean up the whole leg within a shorter period of time. And those have minimal bleeding and minimal recovery time.
According to vasculardisease.org, more than 24 million Americans have varicose veins. 6 million Americans have skin changes associated with chronic venous insufficiency. And up to 35% of adults have leg veins that do not work properly. You'll find the contact information for Veins Florida, along with a link to Go Red for Women, when you click the Chronic Vein Diseases story icon link on our homepage, yourhometownhealth.com.